Welcome, everyone. My name is Rudy Montijo. I'm the host of the Daytrypp'n podcast. Today I have Dr. Quinn Snyder as my guest today. We're being brought to you from Phoenix, Arizona by our host, Rick Phillips, owner of the Merc Bar. So we're in the Merc Bar back room right now. If you're ever in Phoenix, want to grab a drink, want to take a date out, just want a cool place to vibe, the Merc Bar is where you want to be. So thank you, Merc Bar and Rick, for hosting us today. And here at Daytrypp, I'm the COO there. Our slogan is Change Your Mind. And what we want to do is change your mind on all things mental health related. So your belief system on psychedelics, specifically on ketamine therapy, which what Daytrypp does, your limiting belief system, and really expand on what you're capable of. I think that our whole goal is to remove the stigma associated with psychedelics and mental health and really give people the comfort and education that they can have to go out and make a right decision. It's going to help them progress, in their life and increase their quality of life. So Quinn, thank you very much. First question, I guess, why don't you tell me about yourself, your background, your training, where you came from?
Sure, yeah. I'm an emergency physician. I've been working here in the Phoenix area for the past, I'm on my 14th year of practice now, actually. I grew up in LA.
You don't look like you could practice 14 years.
I know. It's just part of my thing, I guess. I don't know. It's always been with me. I don't know, people think I look young. I'm starting to hear less of those now from patients. People are asking me, they used to ask me all the time, are you old enough to be my doctor? I don't get that so much anymore. I got a little more gray hair than you might think, than you could see under this cap, frankly. But yeah, I grew up in LA and then moved out to Phoenix in 1994. Went to Chaparral High School. Did my undergraduate work at Duke. Medical school at U of A, College of Medicine, Tucson.
Tucson at U of A, bear down Wildcats.
No doubt. And then did my residency at a place called Hahnemann University Hospital, Drexel in Philadelphia. Unfortunately, it was the oldest 3-year emergency medicine program for a very long time. It was a wonderful program, but unfortunately the hospital closed down, was frankly overtaken by real estate speculators in 2019. But I've been working here in the Phoenix area since 2010. During that time I was managing the clinical operations for the largest ED in the state. Did that throughout the pandemic, and yeah, it was an extraordinary experience and one I'm glad to have started to move on from, I guess, at least in the administrative aspect. But I love practicing medicine. It's just a wonderful thing. And
so 15-year ER physician. Where are you working at now, if you don't mind me asking?
Yeah, that's not a problem. Yeah, I work at both Banner and I work at Mayo, yeah, I like both clinical environments, frankly.
The reason why I mention that is Banner is the largest healthcare provider in the Southwest. The Mayo Clinic is world renowned for their progressive treatments, but they're also known for having some of the best medical care in the world. So to have you as a part of Daytrypp, which we'll get to down the road, it says a lot for who Daytrypp hires and brings on to help expand and grow their concept and their vision. Ketamine, we're talking about ketamine today. How is ketamine used in your setting? What do you know about ketamine, the history of it?
Yeah, ketamine's an incredible medication. I mean, it might be the most versatile medication in existence. It was first synthesized in 1962. And it was first FDA approved for use on the battlefield in Vietnam, actually, in 1970, and it was used quite successfully there. The term K-hole supposedly actually comes from patients who were receiving ketamine on the battlefield, and in some sort of grievous injury, they would be placed kind of like in a foxhole and allowed them to dissociate for a minute while they kind of figured out a better plan for them.
So they were using it in big injury. They're down in the foxhole, administered ketamine. Is this where they kind of see this has more effects besides actually being anesthetic and numbing the pain? But now we have a mental side of it, or disassociation, which is common with psychedelics.
Yeah, I think they knew when they were first starting to do these studies on ketamine. There were a lot of reports from people. They felt like they were floating and having this out-of-body experience. I'm not sure how much aware of it they were at the time. In Vietnam, I'm sure, it was obviously happening to people while they were under the influence of this medication. But still, yes, they were aware of these effects. And there is kind of like a special dose range with ketamine, a sub-anesthetic dose, where people are more likely to have a dissociative and psychedelic experience.
So if I grab this glass here and break it and cut my leg, could you give me some ketamine right now and I could just lay down?
I could. Not like I have any on me or anything, but I wouldn't necessarily recommend that. But yeah, truth be told, I've seen people with unbelievably terrible injuries. I mean, some of the worst possible things you could imagine. Opiates, sometimes there are patients where you can load people up on so many opiates and they still can't control their pain. I'm telling you, and I've seen this in clinical practice, and this is very much kind of coming into understanding now, is that like ketamine is a medication that can treat these really complex pain issues, acute and chronic pain. But like you have these people, I've had these trauma cases of giving them opiates, one dose of ketamine, all of a sudden they're relaxed, they're fine. And I mean, it gives that dissociative experience in certain ways for a patient who, frankly, probably doesn't really want to be in their body at the time.
Right.
It's not really the time to be miserable. Maybe it's time to take a step outside of yourself. And, I mean, I think ketamine really does that quite successfully.
So one of the biggest questions I get, is ketamine safe? I get this question all the time, and one of the reasons I wanted to bring you on here as the first guest is so people can understand if it's safe, not coming from Rudy, who, I'm a therapist. I'm not medically trained to that extent, but coming from an ER physician, medically trained, Western medicine, works at Mayo Clinic, I think there comes a lot more from you. So is ketamine safe, and how safe is it?
Ketamine is a very safe drug. I mean, it might actually be the safest anesthetic. It's actually the most commonly anesthetic used worldwide.
Used all the time, every day?
Every day, all over the world. Yes, it's a very safe medication. I mean, it's not without side effects. There are some risks to it, but for the most part, yeah, I mean, ketamine, differently than other anesthetics, it preserves airway reflexes, as in patients can still kind of like cough and clear secretions and whatnot. It does result in respiratory depression, similar to the other anesthetics. Of course, that's kind of part of what you're trying to do, is trying to take control of a patient's breathing and whatnot when you're putting them under anesthesia. But yeah, because of those respiratory reflexes that it preserves, yeah, I mean, it's a lot safer. Absolutely.
You mentioned the airway. I've heard of it being a bronchodilator. Is that right?
That's correct. Yeah, I mean, ketamine is actually like one of the cool properties of ketamine is that it results in dilation of an opening of the airways themselves.
So dilation, for those who don't know, is just it's expanding or widening. If you're going to dilate something, you're going to open it up wider.
Yeah, and but with that, I mean, it tends to actually be the medication of choice if you're intubating somebody for asthma, COPD, emphysema, that kind of thing. Yeah, it really is very effective for those patients.
So I had asthma as a kid a lot, and I was in the hospital 2 or 3 times a year. Is there a chance they gave me ketamine?
Probably not. No,
because that would explain a lot. If
No, it's not. It's not used routinely for asthma. There's a lot of medications that are not psychoactive, like albuterol, that will help open your airways. I would just.
I thought I had some justification for my behavior, but apparently I'm wrong. My mom's going to be so disappointed. So, is it safe for kids? Can you administer it to kids?
I mean, I've administered ketamine to toddlers. I've repaired lacerations on very young children under the influence of ketamine. Yeah, I mean, which is not something that we do at our clinic.
What's the age range that you guys use at Daytrypp?
So at Daytrypp, we're able to give ketamine 13 and up. We do teenagers and up. It's not suitable, obviously, for psychotherapeutic purposes for young kids. So yeah.
How does it work in the brain?
Great question. I mean, listen, we're still learning a lot about ketamine, but what we know is that the primary pathway is that it's an NMDA antagonist, so NMDA. It acts on that receptor, and it also appears to typically upregulate mostly the glutamate neurotransmitter throughout the brain. But there's also like this interaction with the AMPA receptor and brain-derived neurotrophic factor, which, as a result, like the overall effect is that it results in neuroplasticity. It literally results in like the structural rewiring of the brain itself.
So that's a very thrown around word and terminology, neuroplasticity. Broken down in simplest form, from my understanding, correct me if I'm wrong, is the brain's ability to change. Is that right?
I mean, yeah, it is. That's exactly right. I mean, I think it's like it's promoting that growth and change of the brain. And like, a lot of people, there's this kind of like emerging theory of sorts of psychopathology in general, that so much of people's issues related to depression, anxiety, trauma, whatever, it it's all, or a lot of it is related to the fact that we keep kind of taking the same pathways, the ones that are very well worn in our lives and in our brains, over and over again. We keep looking at things from the same way, from the same perspective. And sometimes what people really need is they need to just take that snow globe and shake it up and allow everything just to settle back in a different way.
Break the pattern, break the cycle.
Absolutely, yeah.
So let me explain this and paint a picture for everybody. The neural pathways in your brain, if you've ever skied, and if you haven't skied, it doesn't matter. You know what a ski slope looks like. People ski down that run every day. And at the end of the day, there's all these ruts from where people have traveled. Now, those ruts are your neural pathways, and they're shaped over years of your experiences and your habits. The way ketamine can work is it's like a fresh snowfall, allowing you to go and create your own path now and not follow the old ones. So in a sense, you can take negative, unproductive behaviors and turn those into positive, productive ones. Is that right?
I absolutely, no. I think that's a very good analogy. Yeah. Do you ski?
I ski not well. I prefer the greens once in the blues. I've got a video of me crashing in Park City on my 40th. Yeah, I'm good at the. If you can run, jump, or swim, I can do those. Anything else with a paddle or skis, I'm a little shaky on.
Yeah, I'm pretty terrible at skiing, frankly. Yeah.
However, if I were to know how to get ketamine, if I fell down, I might ski more. So we'll have to plan a ski trip. Another question I got is how is it excreted? How is it metabolized? And that compared to other drugs, like you mentioned pharmaceuticals who have like, what are some common antidepressants?
Yeah, so I mean, like the common antidepressants are most people typically are out there are taking what they call SSRIs, which are Lexapro, Prozac, Paxil. That's probably the most common. It's definitely the most common antidepressant on the market. 10% of Americans are on antidepressants. Amazingly, though, their effectiveness only appears to be about 40% of the time. And these are medications that cause weight gain and sexual dysfunction. You have to take them every day. It's a synthetic substance. A lot of people are leery of some of this. It's just, I don't know. There's a lot of reasons why I feel like the world of SSRI, they absolutely have their place. I mean, there's definitely patients that benefit significantly from SSRI, but there's a whole lot of people who don't. And really, I think we're entering this new era where there are some new treatment options, some better treatment options potentially available. To go back to your question that you mentioned about metabolism in general, hepatically, mostly liver metabolism for ketamine, it's pretty much out of the body in the vast majority of people in like a day. It's come up before about like whether or not it shows up on a drug test or whatnot. Listen, frankly, it doesn't matter if it shows up on a drug test. I mean, not like it's routine. It's not routinely tested for, frankly, in drug tests. But listen, when it's being legitimately administered by legitimate practitioners, such as our staff, our nurse practitioners at Daytrypp'n, I mean, it's totally legal. It's safe, and yeah, I mean, it's not like. Employers at this point, if they have an issue with one of their employees using ketamine for their own depression, anxiety, or whatnot, like I just don't even know why that would be the case. I mean, there's so many employees that are probably on benzodiazepines and opiates and do that legally. Like, I don't get it.
So that was a lot there. Let me go back and kind of reframe that. Normal pharmaceuticals, they have their place. We're not saying that this is a snake oil going to treat everybody. There is a place for pharmaceutical antidepressants, but they're only about 40% effective according to research and data. Is that right?
Yeah, the SSRIs, yeah.
The SSRIs. But they also have all of these negative side effects, which you ever see in a commercial, if you take this drug, you can have sexual dysfunction, which is no bueno for everybody. You can gain weight, you can go in psychosis, you can have even increased depression or suicidal ideation, your dog's gonna die, your cousin's gonna leave you. All these things that could happen from taking, what are the contraindications or are there any negative side effects from ketamine?
Yeah, ketamine, I mean, it's not like drinking water. Yeah, there's some other stuff that can happen with it. I mean, the contraindications, like the people that tend to really not be suitable for ketamine are typically people with some cardiovascular risk factors. You know, if you had a heart attack before, if you have an aneurysm, if you have uncontrolled high blood pressure.
And that's because it raises your heart rate.
It can raise your heart rate and your blood pressure.
Okay.
Yeah. And it will do that transiently. I mean, most
What
people
if your
will
blood
do
pressure
that,
is
yeah.
controlled with the medication?
It's fine.
Then you're fine. Okay.
It's fine. Yeah, absolutely. And we check it before people get treatment. And I mean, and from a psychological or psychiatric perspective, patients who have known psychosis, schizophrenia, bipolar disorder with psychotic features. Bipolar disorder, some patients are suitable, some patients are not. But that's all part of the kind of like the screening of what we do. I mean, we take people and we look at them holistically, not just from a pure medical standpoint, but we also look at them from, what psychiatric conditions are they currently being treated for? What is their mindset? Are they going to walk into this with a good mindset or not?
So you're doing a full medical intake, a medical screening, and you're going over medical history, both from a medical standpoint and also a psychological standpoint to really understand, is this person a good candidate for this therapy?
Absolutely, yeah. And I mean, like that's a lot of our goal at the clinic is to make sure that people are prepped for this in a good way, and also, that we're bringing in, that we're selecting the right people to get this treatment. And, and the truth is, like, the vast majority of people are suitable for this treatment. But yeah, selection's really important, and as a result, and by virtue of the combination, by virtue of the fact that we take so many of these like very careful safety measures at our clinic, on top of appropriate patient selection, I mean, our outcomes are great, and our issues with adverse events are exceedingly low. I mean, like we've never had to send somebody to the hospital or anything like that. I mean, yeah.
So touching on that, it metabolizes in the liver. It's usually out of your system within about a day. I get this question a lot too, is it, if I get tested at my work, will I get fired, those kind of things? The answer is no. It's no different as if you were to go to a hospital, have surgery, and will be administered ketamine there or propofol. When used in the correct setting, ketamine is a legal substance. It's not illegal. It's a controlled substance, meaning it has to be given or administered by a prescribing physician, which is what we do at Daytrypp. That answers those questions. Now, back to a pill you have to take every day to have a 40% chance of having some type of success versus ketamine therapy. If ketamine is out of your system so quickly, how long does the effects for maybe antidepressant, or how long can you start recreating these new neural pathways after the fact? How does that happen?
That is a really great question. So one of the really interesting things about ketamine is that we're finding that it's both cumulative and durable. So
break those two things down. I know.
No, it's absolutely, yeah. Cumulative meaning that when you actually take more treatments, it's more than an additive effect, let's say, even. And it's something that in most protocols, like the big protocol that for treatment-resistant depression that was found to be at least as good as electroconvulsive therapy, which it was always the gold standard in treatment-resistant depression. There was a big study that came out in the New England Journal in June of this year. They found that ketamine was at least as good as the gold standard therapy that we had long held. Okay,
that's really important. ECT, electrocompulsive therapy, is that right?
Electroconvulsive therapy.
Electroconvulsive therapy was the gold standard for TRD, which means treatment-resistant depression, and that simply means depression that is untreatable. So before, it was the gold standard, meaning it was the best thing we have out there. Ketamine now is as good, if not better, than that previous gold standard.
That's what the research has shown, yeah. Okay. And I mean, obviously, there's going to be patients that, for whatever reason,
you're going to have outliers.
There's going to be people who ECT is better for them for whatever reason. But yeah, I mean, to me, it seems like ketamine might be that first-line therapy at this point for treatment-resistant depression.
And there's an article, you can find it on Daytrypp website, but there was actually a client we had, and he came in, he's a student at ASU. I won't mention his name here, but you can read it. It's public. It's out there. And he moved from Kansas City, where he had a dark period where he was extremely depressed, and his parents wanted to find him a ketamine clinic out here. And so he came to Daytrypp as part of his maintenance, and it really changed his life. And he's had an increased quality of life. He's doing great. He's in the School of Journalism. He talks about that and how it's worked for him. This is a person who was in his late teens when he started it, did it all through college, now is, I think, a junior or so at ASU. but it has a profound effect on people's life. And this is not with a pill every day. He had, I think, the standard treatment, which is up to 6 sessions at first, and then now he's more on a maintenance phase, and he comes in maybe every few months.
Yeah, and and I want to go back to that, what we were talking about too, the cumulative and durable stuff.
Mm-hmm.
Like, yeah, so you mentioned 6 treatments. Yeah, that seems to be kind of the initial sweet spot for treatment.
At what dosage?
Typically, our starting dose at Daytrypp is 0.5 milligrams per kilogram, so half a milligram per kilogram. And we focus primarily on doing intramuscular injections in the arm. We also do IV infusions, but we feel like the IM experience tends to be kind of a more positive experience. There are fewer side effects and whatnot with injecting, and the bioavailability is almost the same. It's like 93% for IM. But then the other part too is the durable part. And that's what's really exciting, is that it's not just something that, ketamine has, backing up even, ketamine is effective, within hours, which compared to other treatments like SSRIs take it, at least 2 weeks typically just to even get started. Even in that first phase, there's a black box warning on SSRIs saying like, hey, you might have increased suicidality during this time. Ketamine, by the way, is one of the most effective anti-suicidal medications that exists, period. But that effect as an antidepressant, anti-suicidal, anti-anxiety, we're talking minutes to hours. People come out of these treatments a lot of the time feeling significantly improved. But then there's the durable effect, okay? It's not like you just go home for a day or two, you're feeling great, and then you're back again, and you're like, what the heck just happened? I'm just back in myself. No. When you keep adding these on top of each other, when you keep piling these treatments onto it, if you do a half dozen, and and some people feel like 3, at least 3, we start to see a lot of positive effect, but it's clear that like 6 is probably the right number for most people, that you get a durable effect that lasts like weeks to even months. We're talking months and months into the future.
That's really important to know and to let everybody else know is you're going to experience a positive effect after the first session, but to actually increase the optimal outcome, the more, the better, at least up to 6. 6 in how? 6 in a week, 6 in a month. When should they do their 6 sessions?
Usually, probably you probably want to try to do 6 sessions within about a 3-week period.
Okay.
And the thing is, like, so when you undergo ketamine, it typically is about 3 hours. The way that we do it at Daytrypp.
How do you do it?
So well, you're under the influence of the medication for about 60 to 90 minutes when in an intramuscular injection. The whole session though is about 3 hours. So we come in, we try and like get you in the right mindset, get you feeling like you're in a good spot, a comfortable spot, and then at that point we do a test dose. We make sure that you're going to react okay to the medication. Then you get the full complement of the dose, and then patients have a dissociative experience typically.
And then the patients are in the room and they have what's called a trip guide who sits with them, and this trip guide is trained in some type of holistic wellness. They have a background or coaching and ceremonial aspects. They're trained by Aona Olson, who's the medical director there. Now, this trip guide who's sitting with you, because you're the doctor, what type of medical training do they have as far as they're not a nurse or anything else? Well, they can be a nurse.
Sometimes they are, yeah. No, the trip guides come from a variety of backgrounds, right? There's some people who are simply specialists in holding space for whatever reason based upon their prior training. We have we have a variety back, and we have nurses who are guides as well. But they all undergo some basic medical training prior to becoming guides. They learn some of the basic things they need to do, and frankly, like the most important thing that they typically need to do is that they're monitoring oxygen and heart rate throughout the encounter. Our medical staff does as well. We always have medical staff on site. Like there's within arm's reach.
What's
basically.
medical? You always have a nurse. You have an NP, you have MD. You have
NP and or nurse. Are there. Sometimes there's MDs. There's doctors who we work with too. We work with this amazing guy.
So you always have
Joe Tafur. Just to throw that out there.
Dr. Joe Tafur.
Dr. Joe Tafur is a legend. In case you're not aware of who he is, but look him up. He's an incredible man. Yeah.
Dr. Joe Tafur is part of the Daytrypp team. If you don't know who he is, look him up. He's known throughout the world. He holds ceremonies and he's Western trained. He's an MD, but he's also holds ceremonies, ayahuasca ceremonies in Peru and those types of things as well.
Yeah.
Now, you have a full medical staff, but you're not in a medical setting. You mentioned set and setting.
Yeah.
Elaborate on that.
Well, I don't want to say it's not a medical setting, okay? I mean, it's definitely a medical setting. But I think what's cool is that most people walk into the clinic and they look at it and they're like, wait, this doesn't look like my doctor's office. And
not your typical white coats running around.
No, there's not. I mean, we purposefully, this is one of the things I tell people about Day Trip that I love is that like if I had tried to do this myself, if I had tried to design this clinic, it wouldn't have looked nearly as good as it does. Because I come from a background where everything is like plastic and chrome and vinyl or whatever. I mean, it's all like meant to be cleaned, and it's not designed with the patient's well-being in mind, truthfully. And like, this is a place that people can come and they can feel comfortable, they can feel relaxed. So a lot of the medical stuff that's there, I mean, like, you don't see some of like the fact that there's oxygen available, or there's an AED right there, or we kind of purposely keep these elements out of sight, because I think for a lot of people it can be actually very triggering to see a lot of these things. A lot of these people have suffered greatly in the medical system, and they don't necessarily want to feel like they're in a hospital or a typical clinic. Yeah.
Yeah, I think if you haven't visited the site yet, daytrypp.com, you can see some examples of the room, and you can see it's very holistic, very organic. It's a setting that's very conducive for healing versus the alternative. So I think that's a very, very distinction in Daytrypp and how it does things, as well as having this trip guide, a person who's trained to sit with you throughout the entire time, to hold space, help calm your nerves, answer questions, let you verbalize your experience, all those type things. So getting mental health treatment or ketamine-assisted treatment in almost a spa-like setting is very unique to healthcare in general.
I think it's special, and I think but yeah, I think like this is how healthcare is ideally administered. I just feel like so much of healthcare is like trying to remove the human from healthcare, you know, and trying to like make it this heavily protocolized experience that, like, personally, when I've been working in heavily protocolized environments for years. Yeah, I mean, it kind of takes away a certain element of joy, frankly. Yeah, it does.
So thank you for sharing all that. I think the listeners and viewers have a great idea of what Daytrypp has to offer, both from the safety of it, the efficacy of ketamine, how it's used, the medical training that goes into this, as well as the context and the way it's administered, and then who's going to be there with you. What's next for Daytrypp? What do you guys have down the pipeline?
It's a great question. There's a lot of stuff going on with Daytrypp right now. I mean, probably the biggest thing we're doing right now is we are working to open up our new retreat center. Birdsong, no doubt. Birdsong. It is. I mean, it's phenomenal. I mean, it's like this totally incredible house that. It was, I think it was first started, it was in the 30s, wasn't it?
It was in, I know some of these answers, but yeah, it was in the 30s.
It was in the 30s. So it's like, it's got this like Adobe mud hut vibe in certain parts of it. And then they kind of built other parts, like there's some mid-century vibes that were built in the 60s and 70s.
But it's luxurious.
It's incredibly luxurious, but it's got this like super cool aesthetic. It just, it feels like, it's like Adobe plus mid-century on these really lush grounds. There's like a pool, there's, sauna, hot tub, cold plunge, all that good stuff, and decorated in a way that, people who may be watching this don't really know what the Arcadia neighborhood of Phoenix is, but it's got its own aesthetic, neighborhood.
It's got a vibe, as the kids say.
It definitely has a vibe. I mean, you walk into some of these cool places and it's got a certain feel to it, but Birdsong's got that feel. And similar to the Daytrypp Clinic, by the way, it's got that kind of similar aesthetic. It's like a place people want to be. But we're going to be doing ketamine retreats there. So people come and they will be administered ketamine, and we're doing specialty retreats. So like some of them, we have a LGBTQ retreat being planned. There's some corporate stuff that's happening. There's just like a lot of different groups of people that want to use these medications for healing in different ways.
So that's great for now. Daytrypp flagship Arcadia is in the Phoenix area, but if you're not in Phoenix, Daytrypp has retreats where you can fly in from all over the world and stay for a few nights and get ketamine therapy, as well as other modalities. There's yoga, there's massage, there's breath work, there's hand healing. All these in a luxurious setting in the heart of Arcadia, this beautiful place called Birdsong. I think the website's Birdsong 38. If you want to go ahead and look on that, you can see the pictures of what we have to offer there. But very, very cool. And to have other retreats planned, and I know Patrice Roy, she's a psych NP at Daytrypp, we're leading the LBTQ retreat coming up. And to be able to provide this type of treatment for all different types of patient population, because nobody likes to be lumped into one category. Like, everybody wants to be seen. Everybody has their own adversity they face in their life. Like, I'm a recovering alcoholic, and I walk into the rooms of AA. I feel at home because they know me. They get me and I get them. So that's very important that Daytrypp is actually reaching out to different populations to make sure they're seen and treated. That's very cool.
Yeah.
Anything else you want to say? Any questions before we wrap up here?
This is really fun. Thanks for having me.
Thanks for coming in. And I hope we changed your mind out there if you're listening or watching this. I want to thank Rick Phillips and the Merck Bar at Phoenix, Arizona. I want to thank Dr. Snyder for coming in here. And Daytrypp Health and Wellness. Again, my name is Rudy Montijo. Any questions, please go to the website. You can submit all your questions there. You can email me at rudy@daytrypp.com. And until next time, change your mind. Daytrypp.